Mr. Williams, and pleasant good afternoon to everyone. This afternoon, it's my task, as per usual, to share with you the situation report for today, July the 21st. All right, so for today, July the 21st, we have not identified any new confirmed cases of COVID-19. So within the past 24 hours, we do not have any newly diagnosed case to report. And so the total number of COVID-19 cases remain 557. Within the past 9 weeks, more specifically between May 19th to July the 21st, we've added 512 cases to the Federation's COVID-19 tally. We've been noting a rapid rate of recovery, and so to date we have had a total of 514 recoveries. Within the past 9 weeks, we've had 469 recoveries. And so at present, we have 40 active cases. So the team of case managers, they are monitoring just 40 active cases. Over the 9-week period, we've had a total of about 32 hospitalizations. However, at present, we only have one patient admitted to the COVID ward at the JNF General Hospital. To date, we've only had 3 COVID-19 related deaths. This slide shows the incidence, the number or the daily counts between May 19th to July 19th, and then you see the curve. And so based on this curve, I can say that we saw the peak round about the 23rd of June, and we noted a downward trend. And at present, our daily count is within the single digits, and we want to keep it like that. As I said before, with respect to the Federation, we've reported a total of 557 confirmed cases of COVID-19, 539 cases St. Kitts, 18 cases Nevis. We've had a significant number of recoveries, 514, and so we have a remainder of 40 cases, just 40 active cases being monitored. Just to provide you an overview, an update on what's happening within the prison system, well, I must begin by saying that the COVID-19 outbreak within the prison system is under control. Now, we found a total of 56 inmates. A total of 56 inmates have been impacted, but 55 have since recovered. So we only have one, we're only monitoring one active case so far. And then in terms of the staff, the prison staff, 7 staff members have been impacted, 8 have recovered, and we are just monitoring 9 active cases in terms of the prison staff. And again, the Ministry of Health facilitated a very comprehensive training session on infection prevention and control within the context of COVID-19. And this took place on July the 9th. Okay, so this slide shows the vaccine data. So as at end of work day yesterday, Tuesday, July 20, we attained a coverage rate of 71%, meaning 71% of the target population being covered with the first dose, and 58.7% coverage in terms of the second dose. More specifically, 19,389 persons are fully vaccinated. The figures for today just came in. Now, based on yesterday's data, I just wanted to explain a little further that the target population refers to the adults within our, society, and that comprise about 33,037 individuals. Now, in terms of the first dose, 23,448 persons have received their first dose, and 19,389 individuals, as at the end of workday yesterday, received 2 doses or have been fully vaccinated. So, in other words, approximately 9,500 persons or adults within our population have still not come on board in terms of accepting the vaccine. And so this is the subset of individuals that we would continually try to reach in terms of empowering them. We want to empower these adults with the latest information regarding the COVID-19 vaccine in terms of bringing them on board in accepting same. Please note that these figures are based on our last census conducted in 2011, and so the numerical values would more than likely be more than what's outlined on this slide. We continue our robust contact tracing process, and as at July 20, the contact tracing team engaged over 2,585 individuals in terms of, in-depth interviews and placing them in quarantine and isolation. 2,470 individuals have been released from quarantine, isolation, and at present we have approximately 115 persons in self-quarantine/isolation. Testing continues in terms of we continue testing individuals who present to the emergency room with signs with COVID-19 like signs and symptoms. All cases are tested, all contacts of cases are tested. We conduct targeted testing and random testing as necessary. Now, this speaks to the recent change in our health and travel protocols, more specifically referring to the fully vaccinated inbound passengers who would have landed on or after July the 12th. Now, fully vaccinated inbound passengers who landed on Monday, July the 12th or beyond, these individuals would qualify for a reduction in their quarantine period. Well, let me just back up. When we say fully vaccinated passengers, we mean persons who would have received the vaccines that are approved by the World Health Organization. And these include the Pfizer-BioNTech vaccine, the Moderna vaccine, the Johnson & Johnson, the AstraZeneca Oxford, the Sinovac, and the Sinopharm. So these are the vaccines that have been approved by the World Health Organization. So once you would have received the full dosing regimen of these vaccines, and 2 weeks would have elapsed between your last dose and your date of travel, you would be deemed fully vaccinated. So once you fit this criteria, your quarantine period would be technically 4 days. That's 3 days, and your exit test sample would be taken on the morning of day 4. Now, you would only be officially released from quarantine when a negative RT-PCR test result is received from the lab at the end of day 4. So, but please note that if day 4 falls on a Sunday, your RT-PCR test will be processed on the Monday, and so you won't be released from quarantine until the end of workday Monday. RT-PCR test results can be expected within anywhere between 12 to 48 hours. It depends on what's happening at the time. So, for example, 4 weeks ago, when we were in the peak of our outbreak, the results returned within 24 to 48 hours. Now that our numbers are in single digits, the results can be expected within 12 hours. If the sample is taken in the morning, you can expect your results in the evening hours. And please note that this policy change became effective on July the 12th. Now, the way forward means that we all, means you and I, we have to learn to live with COVID-19. And how can we effectively do so? Well, we can wear our face mask at all times. So we need to be very serious about keeping on our face mask, even at work, throughout the workday. You're going to the supermarket, to the restaurant, to the market, wherever, you need to keep your face mask on, covering nose and mouth. You need to wear it properly. Make sure your mask is changed as indicated by the type of the mask that you're wearing. Make sure to maintain good hand hygiene. Sanitize your hands after touching high-touch areas. Sanitize your hands after interacting, passing objects between individuals. Maintain a safe distance of 6 feet or more from others and avoid crowds at this time. And coming on board in terms of accepting the vaccine if you have not yet done so. So in today's world, in July of 2021, living with COVID means wearing your face mask, maintaining good hand hygiene, and a safe distance between yourselves and others at all times. Next. Now, I want to just pause and refer to the certificate of release from quarantine and isolation. And so the Ministry of Health, through the Office of the CMO, has been issuing certificates of release from isolation for persons who have been diagnosed with COVID and certificates of release from quarantine. Now, the Ministry of Health is in dialogue with Social Security, and it was explained to us that this certificate, this signed certificate, can be attached to the formal or official Social Security sick leave form, which can be accessed at the URL as noted on the slide. Now, the Social Security form, Section A, must be completed by the employee or the insured, and Section C must be completed by the employer. And this form can then be attached to the certificate of release from quarantine isolation. And this can be submitted to Social Security in order for your claim to be processed. Please note that the CMO's letter will suffice. And so individuals, it's not necessary for you to go and see or pay another physician to complete Section B of the form. Just to recap, the roles and responsibilities of the 311 operators. They are meant to assist nationals and residents who are experiencing respiratory tract symptoms. So if you are experiencing COVID-like symptoms and you need help or you have a question, feel free to call 311. They are meant to address callers with issues pertaining to individuals in quarantine and isolation, and to provide you any information regarding the general health system. So if you have a health-related question, you can refer this to the 311 operator. If you've been vaccinated with the Oxford AstraZeneca vaccine and you are experiencing side effects, you can also provide us that information through the 311 operator. If you are in need of psychological support, you can call 311 and they can link you to help to the psychologist, psychiatrist, etc. Now, the 311 operator can also provide linkage to port health surveillance technicians, the police for curfew clearance. They can provide you information regarding COVID-19 testing requirements, and they can share or they can answer questions that are related to quarantine isolation, and they can provide linkage to the Department of Social Services with respect to your accessing care packages and financial assistance. Thank you.